I'm Councillor Richard Harrop. I'm the Cabinet Portfolio Holder for Adult and Carers Services for the East Riding of Yorkshire Council.
So Councillor Harrop, are you able to tell us a little bit more about what this charging consultation is all about?
Yeah, it's a process that's starting now and actually going on till the first few days of the new year. And what we'd like to do is get the views of all the service users, the carers, care providers, and everybody connected with adult social care in the East Riding, and get their views on what we charge and how we charge for services that we provide.
And are you able to tell us why the Council is doing this public consultation?
Well, the reason really stems from some legislation that came out in April this year called the Care Act. And one of the things that the Care Act tells us is that we must review our charging policy, and we can't just assume that what we've done in the past is the best thing and carry on doing it. What we need to do is talk to people who use the services. We want to make sure that they understand that it's a fair system, it's a transparent system, and we really want to do what people want us to do, not what we think we should do. This is one we'd like to ask you to take the time to fill in and really help us with your thoughts. If you're a service user or a carer or a care provider, you will receive a questionnaire in the post. And then it's a question of filling it in with some help from a friend or whatever. It's your views we're looking for, but you can have somebody help you fill in the form and then send it back to us. You can access the questionnaire on the internet on www.eastriding.gov.uk, and during the course of the consultation process we'll be having a series of drop-in events around the East Riding. You could go along to one of those and somebody will be there to help you and give you some advice on filling in the form. It's just however you do it, we really would like to hear from you.
Being a carer means that I'm on duty 24 hours a day, 7 days a week throughout the year. I have very little respite, but because the love that I have for my family, I do whatever is necessary to ensure that their needs are met, sometimes a sacrifice on my own life. As a carer, I have been given a job that I did not apply for. I did not submit my CV, and this applies to many carers out there. It is important that when policies come out from central government through acts like the Care Act, that we as carers are a part of that consultation process, and we must ensure that the services that are being provided best serve the needs of carers. It's important that carers answer the questions that are being imposed upon them through the charging policy, because the more carers that get involved, the more that the local authority can understand their needs and their requirements. This is a very fundamental part of what's been coming out of the Care Act, and whilst the charging policy in principle has been deferred till 2020, there are elements of that that need to be implemented by 2016.